So the history of vitamin C began in the 70s when Dr. Linus Pauling, who was a very bright person, he obtained Nobel Prize for Medicine and a Nobel Prize for Peace. He came to the conclusion, or he's one of the ones that found out that malignant cells live in oxidation rather than in redox. So in our body, we have parts that are acid and parts that are alkaline, correct? And we have things that are in oxidation and things that are in reduction. And a normal cell likes to live right in the middle. No oxidation, no. But malignant cells, they create, because of the metabolic changes that I mentioned before, they love to, their comfort zone is in oxidation. And so Linus Pauling, who was one of the biggest studies of vitamin C as the best antioxidating agent, said, well, if the malignant cell is in oxidation, why don't we antioxidate? Very logical. And nobody believed him, and he started treating patients. Here in America, they didn't want to do anything. So he did a couple of clinical trials in England using what was then called mega dosages of vitamin C. And so he started giving the patients 10 grams of vitamin C a day, IV, for about a week or 2 weeks, and then 10 grams or up to 10 grams orally for the rest of their lives. And in both studies, the patient, all in cancer patients stage 4 that had received everything, that the patients were sent home to die. In both studies, the patients that received the vitamin C lived about a year longer than the other group. So there was objective evidence that vitamin C helped. But then a number of studies were published that showed that it was virtually impossible to bring the oxidative stressed cells to redox with antioxidants. In laboratory, they tried everything and it just didn't work. So vitamin C went through the wayside for many, many years. We used it, according to Linus Pauling, for many years. In the late 90s, a researcher, head of the NIH, okay, the head research for the National Institutes of Health, looked at those studies and said, we're missing something. There's definitely something there. And not to make a very long history longer, I will make it very short. He said, let's look into it again. And he found that it was definitely possible to kill malignant cells with very high dosages of vitamin C. And so the question is, if you cannot antioxidate the cell, how is it that it works? Well, one of the most effective ways to kill malignant cells, and that's been known for many, many years, is by stressing the cell into more oxidation. And they're called oxidative stress therapies. For instance, all radiation therapies kill malignant cells in that fashion. And the actual killing agent is peroxide. So you give radiation therapy, but the killing agent is peroxide. There are many chemotherapies that they kill the malignant cell through the same mode of action. So the question was, well, why don't we skip everything and just give peroxide to the patients? And we did it for a long time, but nothing happened. It took another research to come up with the finding that we have an enzyme that neutralizes peroxide. And that's why when you give peroxide, it doesn't work. And that's why when the tumors, and the tumors are very low in this enzyme. But when that enzyme is high, radiation or chemotherapy, it doesn't work. No, it will neutralize the peroxide. So what this guy, and his name, by the way, is Mark Levin. Now, for all of those political people, it's not the same Mark Levin as the lawyer commentator. There's another Mark Levin. But at any rate, what he discovered is that vitamin C, in the presence of oxygen, in very high dosages, converts from an antioxidant into an oxidant. So high-dose vitamin C works the same as chemotherapy without any of the side effects, zero side effects. And all of this was published. So there has to be oxygen within the tumor tissue, and tumor tissue protects itself very well from oxygen. The only element to date proven to increase the amount of oxygen within the tumor tissue is ozone therapy. And so we give ozone therapy to our patients. And in order to begin the process of oxidation, an electron has to be lost. And when you use an electron, the cell steals an electron from somebody else. And so these guys at the NIH decided to use a catalytic substance to donate electrons, and the best one is vitamin K. So there has to be a process. Timing is very important, and how you give the vitamin C in order to convert it into a chemotherapeutic agent. And we've been doing this now for almost 2 decades, very, very effectively. And so that's how you can use a natural element as an effective and aggressive anti-tumor agent.